We have several guidelines that cover that. We have guidelines for specific medications like buprenorphine naloxone. We have guidelines for injectable buprenorphine, for injectable naltrexone. So we have specific guidelines that will give you some guidance on how those best practices for using those medications. We also have guidelines that address specifically things like which. This one we have it. It's not technically behavioral health, but we do have it under the behavioral health content is long-term opioid management, which is not necessarily about opioid addiction, but it's about patients with chronic pain that require long-term opioid therapy. How do you manage that using best practices to avoid issues of addiction and things like that? We also have a medication-assisted withdrawal guideline that has a lot of good information about medication-assisted therapy, which is essentially the standard of care at this point. I mean, if the evidence is very, very clear that prescribing medications like buprenorphine, methadone reduce harm and reduce the negative consequences of opioid addiction, and we have very good guidance on those. Not to mention, we have kind of like what I think of the generic guidelines. We have guidelines for like substance abuse and for withdrawal management that are more focused on determining the appropriate level of care, which for opioid is most of the time outpatient, but sometimes patients with opioid use disorder might require an admission to a residential program, an IOP program, and in those cases we have guidelines that offer guidance on making that decision as well.